There is a natural spice that research shows works as effectively as Prozac for treating mild to moderate depression in older adults. It is not St. John's wort. It is not St. John's wort. It is not fish oil. It is saffron, the most expensive spice in the world, but also potentially the most medicinal. Clinical trials show it improves mood, reduces anxiety, and even protects vision, all without the sexual side effects or weight gain of prescription antidepressants. By the end of this video, you will know exactly how much saffron to take, which type to buy, and who should avoid it completely. Depression after 60 is common but often ignored. People think it is normal to feel sad as you age. It is not normal. It is treatable. Everything I share today comes from published psychiatric research, clinical trials, and meta-analyses, not opinions, not herbal folklore, just hard scientific evidence. But first, let me explain why saffron works, because it is not magic. It is biochemistry. Saffron contains powerful bioactive compounds like crocin and safranal. These compounds increase levels of serotonin, dopamine, and norepinephrine in your brain. These are the same neurotransmitters targeted by prescription antidepressant medications daily. Serotonin regulates mood and sleep. Dopamine regulates motivation and pleasure. Norepinephrine regulates motivation and pleasure. Norepinephrine regulates energy and focus. Saffron boosts all three naturally and simultaneously. It also acts as a potent antioxidant and anti-inflammatory agent in the brain. Neuroinflammation is a major driver of depression in older adults specifically. If this kind of honest health information matters to you, hit subscribe right now. I make videos like this every single week here. Now let's look at the research. Because the studies on saffron are surprisingly strong, stronger than almost any other natural antidepressant supplement available. A randomized, double-blind study compared saffron to Prozac, fluoxetine. After 6 weeks, both groups showed significant improvement. There was no statistical difference in effectiveness. Let that sink in. A natural spice extract worked just as well as a leading pharmaceutical drug, but with fewer reported side effects. Another study compared saffron to imipramine, an older antidepressant. Again, saffron was equally effective at reducing depression scores over a 6-week treatment period. A meta-analysis of 5 clinical trials concluded that saffron supplementation significantly reduced depression symptoms compared to placebo controls. The evidence is consistent. Beyond depression, saffron also helps with anxiety. A study found that saffron extract reduced anxiety symptoms by 50% in adults with mild anxiety. And here is a bonus benefit for seniors. Saffron protects vision. It improves retinal function and may slow age-related macular degeneration progression significantly. A study in Italy found that early-stage macular degeneration patients who took saffron daily experienced improvements in visual acuity after just 3 months. So you get a mood boost and eye protection in one pill. That is a powerful combination for anyone over 60 years old. Now let's talk about dosage. You cannot just sprinkle saffron on your rice and expect medical results. The culinary dose is too low. You need a concentrated, standardized extract. The effective dose used in almost all clinical studies is 30 milligrams per day. 30 milligrams, exactly. Usually this is taken as 15 milligrams twice daily, morning and evening, or 30 milligrams once daily. Both dosing schedules appear equally effective. Look for an extract standardized to contain at least 2% safranal or crocin. These are the active ingredients. Standardization ensures potency in every pill. Common standardized extracts include Afrin and Saf are active. If a supplement uses these patented forms, you know you are getting the exact formulation used in research. Saffron is expensive. If you find a cheap supplement, it is likely fake or adulterated. Real saffron extract costs money. Expect to pay $30 monthly. Adulteration is a huge problem. Some companies mix marigold or turmeric and label it saffron. Always buy from reputable brands with third-party testing. Now, if someone you love is struggling with low mood, share this video with them right now. This natural option could change their life. Let's talk about safety. Saffron is generally considered safe, but it is not for everyone. There are specific groups who need to be careful. Warning 1. Bipolar disorder. Saffron boosts mood effectively. In people with bipolar disorder, this could theoretically trigger a manic episode. Consult a psychiatrist first. Warning 2. Low blood pressure. Saffron can lower blood pressure. If you already have low pressure or take medication, monitor your levels closely. Warning 3. Allergies. If you are allergic to olives, lolium, or salsola plant species, you might be allergic to saffron too. Watch for reactions. Warning 4. Surgery. High doses of saffron may thin the blood slightly. Stop taking it 2 weeks before any scheduled surgery to prevent bleeding. Can you take it with antidepressants? This is the big question. Some research suggests saffron can be used as an add-on therapy safely. A study found that adding saffron to SSRI medication improved sexual side effects caused by the drug. It reduced dysfunction in both men and women. However, combining serotonin-boosting agents always carries a theoretical risk of serotonin syndrome. Always talk to your prescribing doctor before mixing herbs and drugs. Now let me explain what results to expect. Because natural medicine works differently than drugs, it is often slower but gentler on your system. Week 1. You probably won't feel much, maybe slightly better sleep. Saffron takes time to build up neurotransmitter levels in your brain tissue. Week 2 to 3. You might notice you feel less irritable. Little things don't bother you as much. Anxiety levels start to drop noticeably. Week 4 to 6. This is when the full antidepressant effect kicks in. Motivation improves. Energy lifts. The fog of depression starts to clear away. Be patient. Give it a full 6 to 8 week trial before deciding if it works. Consistency is key. Take it every single day. Depression after 60 often has physical causes. Inflammation, vitamin deficiencies, hormonal changes. Saffron addresses the inflammation and neurochemistry parts of this complex puzzle, but supplements are not a complete cure alone. You must combine saffron with lifestyle changes for maximum sustained relief from depression symptoms daily. Step 1. Sunlight. Morning light increases serotonin naturally. Get outside for 20 minutes every morning. It sets your circadian rhythm and boosts mood immediately. Step 2. Movement. Exercise releases endorphins and BDNF. It is the most powerful natural antidepressant known to science. Walk daily. Lift weights weekly. Step 3. Social connection. Loneliness drives depression in seniors. Call a friend. Join a club. Volunteer. Human connection is medicine for your brain. Step 4. Nutrition. Eat anti-inflammatory foods. Omega-3 fats. Leafy greens. Berries. Your brain needs raw materials to build happy chemicals daily. Saffron works best when your foundation is strong. It gives you the boost you need to start doing the healthy habits that keep you well. If you are feeling hopeless or having dark thoughts, please seek professional help immediately. Supplements are for mild to moderate symptoms, not crisis situations. Depression is not a weakness. It is a biological condition. Treating it is smart, using proven natural tools like saffron as a valid medical strategy. You deserve to enjoy your later years. You earned this time. Do not let untreated mood issues steal your joy and peace of mind. I have seen saffron change lives. People who felt flat for years suddenly feeling vibrant again. It is worth trying if you are struggling silently. Now, if this video helped you, I need you to do 3 things for me. They cost nothing and help others find this guide. First, hit subscribe and turn on the bell notification. I post honest research-backed health content every single week, specifically for people over 60. Second, share this video right now with someone you love who seems down or anxious. This simple spice extract could be their solution. Third, drop a comment below. Tell me if you have tried saffron. Or share your mood tips. I read every comment personally and respond. Next week, I am covering the 4 medications that increase fall risk after 60. Common drugs that cause dizziness and loss of balance silently. Subscribe now so you do not miss it. That video could prevent a hip fracture and save your independence. It is critically important information. That is it for today. No fluff, no gimmicks, no lies. Just honest truth for people over 60. Be happy. See you next time.